Welcome to the Hepatitis Foundation of New Zealand's video, a clinical pathway for the Hepatitis C pilot, a guide for health professionals. I'm Matt Walker, and today I'm going to talk through the clinical pathway for the pilot, which is operating in the Bay of Plenty, Capital and Coast, Hutt Valley, and Wairarapa DHBs. In this video, I'll be talking about identifying patients, the testing pathway, the referral process, and the community assessment and support program. First off, let's talk about identifying patients. In your practice or organisation, it is likely you have some patients who are already diagnosed with hepatitis C. We recommend you use existing systems to identify these patients and then contact them to discuss the option of referring them to the Foundation so they can enrol on the Community Assessment and Support Program. When you speak with them, it is vital you obtain their consent before progressing any further with the referral. There are a number of ways you can refer to the Foundation. I'll be talking more about this a little later on. We know of the approximately 50,000 people living with hepatitis C in New Zealand, 75% of them are unaware they have the disease. Consequently, it's important health professionals working in all contexts adopt a risk factor-based approach to identifying these people who may be at risk of having hepatitis C. The Foundation's clinical working group identified 6 main risk factors for hepatitis C in New Zealand. These are as follows: people who have ever injected drugs, even once, people who received a blood transfusion or blood products before 1992, which was when blood started to be screened for hepatitis C in New Zealand, people who have ever lived or received medical care in a high-risk country. High-risk countries include China, Southeast Asia, Eastern Europe, including Russia, and the Middle East. People who have ever received a tattoo or body piercing using unsterile equipment. People who have ever been in prison. And people born to mothers infected with hepatitis C. The testing process. The first step in the testing process is the pre-test discussion. Here, it is important you discuss the need for obtaining a test for hepatitis C. The risk factors discussed earlier will provide some basis for this discussion. Then, it is again vital you gain consent from the patient to engage in the testing process. There are a number of locations patients can access testing for hepatitis C once they have provided consent. These include general practice, via the Foundation, secondary care, sexual health clinics, the Community Alcohol and Drug Service, the AIDS Foundation, the Department of Corrections, a Māori healthcare provider, or through needle exchange services. Testing for hepatitis C involves 2 blood tests. The anti-HCV test looks to identify the presence of antibodies for hepatitis C in a patient's bloodstream. If a patient presents with these antibodies, which is referred to as being antibody positive, they require a follow-up test to confirm diagnosis of hepatitis C. If there are no antibodies present, the patient may require a follow-up test in 3 months, particularly if the risk of exposure is recent. The patient may also require education around avoiding activities that may place them at high risk of becoming exposed to the virus. The second blood test is the polymerase chain reaction or PCR test. This test is used to confirm a diagnosis of hepatitis C. If a patient presents with a positive PCR test, they have the virus. In this instance, the patient will need a consultation to discuss the results. It's important these patients are assigned the correct read code in the medtech system If a patient presents with a negative PCR test, they do not have the virus, but they will require some education around avoiding activities that may place them at high risk of becoming exposed to hepatitis C. As noted above, following the PCR test, it's important the patient participates in a post-test discussion. Here, you can discuss the results of the testing process. If the patient has a confirmed diagnosis of hepatitis C, it's important you offer the patient the option of being referred to the Foundation to receive support through the Community Assessment and Support Programme. As with previous stages, it's vital you obtain patient consent before progressing further. So, what's the referral process? Once the patient's given consent, it's time to refer them to the Foundation. There are a number of ways you can do this. If the facility is available in your area, you can refer them via your online health network or e-referral system. You can contact the Foundation. You can call them on 0800 33 20 10. You can email them at referral@hepatitisfoundation.org.nz. You can refer online via our website. You can send the referral in the post, or you can fax the referral. If you send the referral via email, it is imperative you comply with the Health Information Privacy Code, as well as any local DHB requirements, such as encryption of emails. Alternatively, you can send the referral on to secondary care, who will forward the referral onto the Foundation for processing. In addition to referral via a health professional, patients can self-enroll onto the programme. They can call the Foundation on 0800 33 20 10. They can email us at referral@hepatitisfoundation.org.nz. They can enrol online via the website. They can send the referral in the post, or they can fax the referral. Once we've received the referral, two things will happen. The health professional who referred the patient will receive confirmation of receipt of the referral. This is usually done by email or post. Patients will receive a welcome pack, which gives some information about the programme and lets them know we will be in touch to arrange an initial appointment. The next phase is the Community Assessment and Support Programme. Once enrolled on the programme, the patient will be contacted for an initial assessment with the community hepatitis C nurse. This assessment may take 2 or 3 sessions to complete. It generally includes the following: a thorough medical history, discussion of current and previous lifestyle and social supports, and some additional blood tests. These tests are usually a genotype test, an IL-28B test, liver function tests, tests for HIV and hepatitis B, and an alpha-fetoprotein or AFT test. If a patient presents with severe fibrosis or cirrhosis, they will also be tested for hepatitis A. As part of the assessment, the nurse will be looking for signs or diagnosis of cirrhosis, hepatocellular carcinoma or HCC, or other complications. If any or all of these are present, the patient will be referred to secondary care for a review. They will, however, continue to have access to other support and education provided through the Foundation. During assessment sessions and beyond, the community nurse will be educating the patient about a range of topics. These include the hepatitis C virus, liver functioning, risk factors for hepatitis C, preventing transmission of the disease, disease progression, looking after the liver, lifestyle modifications, and treatment options. The patient will also be directed to other support provided through the Foundation. This includes a range of peer support options, such as peer support groups, telephone-based support, or online support, our quarterly magazine, Talking Hep C, the website, social media tools such as our podcast series, and our helpline service. An important part of the assessment process is the Fiberscan Assessment. This assessment investigates current liver functioning by operating in a similar fashion to an ultrasound scan. The assessment takes around 5 minutes to complete and is a painless, non-invasive procedure. However, sometimes a reading cannot be successfully obtained. When a successful reading is taken, one of two things may happen. If a patient's liver is shown to be non-cirrhotic, they will continue to receive support from the community nurse via the long-term follow-up program. If, however, the Fiberscan indicates severe fibrosis or cirrhosis of the liver, the patient will be referred to secondary care. In this instance, the patient will still receive some support from the Foundation, but the hospital will act as the main health provider. Whether or not a patient presents with severe fibrosis or cirrhosis, it may be necessary to refer the patient to other services, such as mental health services. When a successful reading cannot be obtained, the patient will need to be referred to secondary care to undergo a Fiberscan assessment using an XL probe. The results of this assessment will determine the subsequent steps. So, what's the role of secondary care in the program? As the description so far indicates, the role of secondary care is a multifaceted one. It's important that secondary care refers to the Foundation those patients who are currently under their care and are being monitored but not receiving treatment. Refer to the Foundation those patients who require a Fiberscan assessment. Accept all referrals for those patients who wish to receive treatment. Accept all referrals for those patients who present with severe fibrosis or cirrhosis. Take responsibility for ultrasound and blood tests for patients referred to them, and collect the necessary data. Once the assessment phase is completed, patients will move onto the long-term follow-up phase of the Community Assessment and Support Programme. During this phase, patients will receive the following: regular contact from the community nurse, either by phone or through face-to-face appointments, annual blood tests, a Fiberscan review as required, the frequency of which is determined by initial results, access to support, including peer support, magazines, helpline services, the website, and social media resources, and review for referral to clinical trials or new drug therapies as appropriate. Following assessment, the community nurse may refer the patient to secondary care for treatment. Once received, the hospital will arrange an appointment for the patient, where a specialist will meet with them to review their case and ascertain their suitability for treatment. They will then begin treatment as appropriate. During treatment, the patient will continue to have access to support via the Foundation. For cases where treatment is successful, the patient will then exit the program. If, however, treatment is unsuccessful, the patient will move back into the long-term follow-up program. From the moment the patient is enrolled with the Foundation, the community hepatitis C nurse will continue to liaise with health professionals from different settings. The community nurse will hold regular patient management meetings with teams working in secondary care. In cases where other agencies are involved, for example, mental health services, the community nurse will liaise with staff working in these agencies to ensure everyone remains informed of patient progress. As long as the patient provides consent to do so, The community nurse will also continue to engage with the patient's GP to keep them informed. If you require further information about the clinical pathway or any other element of the Hepatitis C pilot, you can contact the Foundation. Visit our website at www.hepatitisfoundation.org.nz. Here, there is a wealth of information about Hepatitis C, the support the Foundation provides, and resources for patients and health professionals, which include podcasts, brochures, our quarterly magazine and e-newsletter, and the latest news and research from around the world. Call us on the Hepatitis Helpline on 0800 33 20 10. This is open to patients, people supporting others living with Hepatitis C, and health professionals. You can also keep up to date with the latest developments by following us on Facebook and Twitter. If you want to know more about the Hepatitis C pilot, watch the video of the recent launch of the pilot, which explains the program in further detail. In the meantime, make sure you do what you can to support and participate in this program and to confront Hepatitis C. Know it, test it, treat it.